This is my simple sterile dressing change using the no-touch technique. Before I start, I wanted to verify that Humulin N is your basal dosing insulin and is the NPH insulin. It is your long-acting insulin and it regulates your sugars all throughout the day rather than just at meal times like your bolus dosing does. Carrying on with my dressing change, I have already confirmed my patient's name and birth date against his wristband, as well as made sure he was feeling okay, that he was comfortable, and that he wasn't in any pain before we begun in case I needed to administer any pain medication. So we're going to start out today by removing his old dressing. I've already told him the process of what we're going to be doing, and I'll keep him in the loop as we go. So I'm going to start by sanitizing my hands and applying a pair of gloves before I remove his old dressing, just in case any drainage touches me or anything. I want to protect myself. Okay, and when I'm removing his old dressing, I want to make sure that I peel it away from myself and that the dressing is that the dressing is facing myself and not the patient, so that if there's a lot of excess fluid or anything like that, or drainage that has gotten on the bandage, that they don't have to see it. So I'm going to go ahead and hold the skin and pull away. Perfect. And I'm checking my bandage to see what the drainage is like on there and making sure that everything's healing well. Also looking at the wound itself. And I have a garbage can below me here, so I'm just going to drop it. I can remove my gloves. And I'm going to sanitize again, and then I'm going to start to open my sterile field. My patient's doing well. He tolerated that well, no pain at all. So a few things to remember when dealing with sterile fields. We want to remember to not face our back to it at all, that anything hanging over the edge is considered contaminated, that we cannot hover above our sterile field, as that will also contaminate our sterile field, and that everything needs to be above our waist as well. So I'm going to start by opening this away from myself. So I'll take the first corner, pull that away. Then I can go with the first side and pull that. And I want to try and touch only on the back side and in the 1-inch border when I'm opening it to maintain that sterile field as well and not contaminate anything while I'm opening. And then I'm going to open this side. And when I open the last flap, there is a pair of forceps here. So I want to take those and lay those with the handle within that 1-inch border, since I've now touched it and it's no longer sterile. So then I can take my corners here and square this off. And then I'm going to take my forceps and remove the garbage, which I already have a garbage here, so I can just dispose of this. And then I will take out, this is just a layer of plastic that we're going to put underneath our patient's wound, so that if any saline or anything like that drips over top of it, that we can make sure that the fluid goes on here and not on his skin or on his clothes. And again, just making sure we're not hovering over our sterile field. I'm just behind it right now when I'm holding this up. So we can go ahead and place that down. And we can go ahead and place our forceps down as well. And I would never do this to a patient, but for the sake of this video, I am just going to slide this underneath this wound. There we go, fresh as new. Okay, and to begin, I am going to grab my saline here, and I want to make sure that it is sealed, that it is not expired, and that the solution that I'm using matches the doctor's order as well. This one is not sealed because I've been practicing with it, but in most cases I would make sure that my saline is sealed. And trying not to hover above my sterile field, I'm just going to empty as much as I can of my saline into a compartment of my tray. There we go. And then I'm going to go ahead and start cleaning his wound. I don't need gloves for this, as I'm using the no-touch technique, so I'm actually not touching his wound directly with anything. other than the forceps, which are sterile. So I can go ahead and take my first piece of gauze. Sorry, I'm not gonna grab my forceps out there with my hands. I'm gonna make sure that I touch them with my other pair of forceps. Again, just laying the handle within that 1-inch border. And then I can go ahead and grab my forceps here. And I'm going to take my first piece of gauze, soak it into the saline, and then we can take it out. And we just want to drain some of that excess liquid out. And then I can go ahead and do my first wipe, which I'm going to do from top to bottom, making sure that my tips are down, going from top to bottom, starting with the midline. So just one wipe. Perfect. Then we can go ahead and discard that. And then going in for the second piece of gauze. And again, just soaking it in that saline solution, grabbing it with my other pair of forceps to drain out that excess liquid, and keeping my tips down. We are going to go and do the far side, again from top to bottom. Then we can discard of that. And then I'm gonna grab my third piece of gauze here, and wring that out to get rid of some of that excess liquid. And then we can go in with that third and final swipe with the saline. So again, going from top to bottom, and I'm gonna go to the side closest to me now. Top to bottom. And then we can discard that. There we go. And then I'm going to grab a dry piece of gauze, I don't need those, in order to dry the wound, as this is the dry dressing change. So grabbing my first piece of gauze, tips down, I am going to go from top to bottom and clean what I started with, center of the wound. And I can discard of that. And then I'm going to grab another piece of gauze and go from the farthest side, top to bottom, and dry that. Perfect. And then I can go for my last piece of gauze and dry the side closest to me, top to bottom, to ensure the wound is fully dry. There we go. So now I am going to open my sterile gauze so that I can take that out and start to apply the fresh dressing to his wound. So I have the sterile gauze here. Just gonna open it up, and using a pair of forceps to take each piece of gauze out, I am just gonna lay that over top of the wound for protection. And another piece there, perfect. You can discard of that. And then I was using Mepor, but I am going to be using an ABD pad since I did run out of Mepor. So opening it like this and grabbing my forceps here again. I am going to just grab the corner of this, and we want to make sure that the blue line is on the top. And I'm just going to lay that down over top of the wound and adjust it as it needs. We can throw this out. And then I'm just going to go ahead with some tape and secure it on to my patient's skin. And I did pre-cut this tape beforehand, knowing the size of the pad. That way I had less of a chance of breaking my sterile field as well with having to stop to cut some tape. And again, my patient is feeling okay. I've been talking to him throughout this entire process. And there we go. And to put away my sterile field, I'm just gonna put everything back in its tray.